Everyone, and welcome. Thank you so much for joining us today for a joint webinar hosted by the Center for Developmental Psychiatry and the Lukin Center for Psychotherapy. My name is Natalia, and I'll be moderating today's discussion. And today's topic is one that so many families have questions about, and it's understanding ADHD and how it shows up across ages. And our panel today will explore how ADHD presents in children versus adults, when medication might be appropriate, and how therapy and psychiatry can work together to provide comprehensive care. We'll also touch on family dynamics, school considerations, and practical ways parents can support their children. So today I am joined by Dr. Jason Dean, child and adolescent psychiatrist and the founder of the Center for Developmental Psychiatry, Dr. Konstantin Lukin, clinical psychologist and the founder of the Lukin Center for Psychotherapy, Dr. Divya Patel, child and adolescent psychiatrist here at Center for Developmental Psychiatry, and Lauren Bomberg, licensed clinical social worker at the Lukin Center. So before we jump into any questions, I'd love to maybe start with everybody briefly introducing themselves and sharing a little bit about the work that they do. So Dr. Dean, did you want to get us started?
Sure. Hi, everybody. I'm Jason Dean. So I am a child, adult, and adolescent psychiatrist and also an adult psychiatrist. I see patients as young as 2 or 3 years old, all the way through all ages of children, teenagers, and adults as well. We see really pretty much every condition. We see a lot of ADHD, which we're talking about today, a lot of people on the autism spectrum. And I think what we try to do at the Center for Developmental Psychiatry is to try to take more of like a holistic kind of comprehensive view. So we try to see people for longer periods of time, like 45-minute follow-ups every few weeks, things like that, to really get to know the patient, get to know the family. And we're really trying to understand how the symptoms and medication piece fits into who a person is as an entire person and family dynamics and things like that. And we've appreciated working with the Lukin Center very closely because one of the big things that we try to do is really collaborate very much with therapists and the treatment team. So that's why we're excited to do this webinar together with you guys.
Wonderful. Dr. Lukin, can you share a little bit about yourself as well?
Sure. My name is Dr. Lukin. I'm a clinical psychologist. I started the Lukin Center about 12 years ago. So this is we're growing as time passes. We are on 7 different locations. We have about 54 different types of providers working with kids, adolescents, adults, couples, families. So it's it's an extensive network of clinicians. And what we try to do as well, sort of to kind of piggyback on what Dr. Dean was saying, is trying to make sure that we are focusing on the patient and trying to coordinate the best level of care. And that's why this is such a great opportunity for us to partner up, because to talk a little bit about how medicine plays a role, how psychotherapy plays a role as well. We typically pride ourselves on our triage process. We have the signature way of how to pair up the patients that are calling in with the best type of provider for them. So that really stands out as something that we'd like to offer to the people that are calling in.
Okay, great. Dr. Patel?
Hi, yes. So my name is Divya. I'm a child psychiatrist as well as an adult psychiatrist. Really piggybacking off of both what Dr. Lukin and Dr. Dean shared, I really enjoy working with families as a whole and understanding, what environment the child is living in, studying, and, and what kind of struggles they're having in those environments. So it helps me better support the child as well as the parents in navigating some of these struggles, as well as highlighting their strengths. And I really believe in a strength-based approach with kids and families. So I'm excited to be here today and talk more about ADHD and hopefully give everyone a little bit more insight on both the benefits of medication as well as pairing it up with therapy and how that can help your kiddo really succeed in all aspects of their life.
Great. And Lauren?
Yes, my name is Lauren. I am a licensed professional counselor and board certified dance movement therapist, a form of creative arts therapy. I work primarily with children with neurodevelopmental, social, emotional, and behavioral challenges while supporting their parents with positive solutions. And Anxiety and ADHD are definitely the top diagnoses I see. And like Dr. Patel, I also take a strengths-based approach, very solution-focused, playful, child-directed. I like to let the kids lead me to what they need the most.
Wonderful. And then of course, Gabrielle, Executive Director over there at Lukin Center. Hi.
Hi. Hi, everyone. Gabrielle Wani. I'm Executive Director and also a licensed creative arts therapist. I love that we're having this webinar today because it shares and shows our partnership as, our mission and values are the same. And that's why I think we're coming together today to share about all of this. I'm really excited to be here. So thank you.
Perfect. Well, thank you all so much for those introductions. I think this is going to be a really great discussion. So with that, we can go ahead and get started with our first question. This is going to be a topic kind of understanding ADHD across the ages. So we have, how does ADHD tend to look different in children versus adults? And what are some similarities you both see in your clinical work?
I'll jump in. I tend to see that the core traits are similar, but how they manifest will shift with age or the nature of the responsibilities, right? So for the kiddos, they're more physical, running, climbing, fidgeting. If hyperactivity is a primary presentation, or if inattention is taking the front seat, it could look like a delayed response. What did you say? Or I didn't hear you. It might look like forgetfulness, misplacing things, careless errors on homework, leaving things at school. Whereas for adults, it could be more subtle. Maybe just an internal restlessness or difficulty initiating their tasks, prioritizing their tasks, getting motivated, staying organized and on top of their responsibilities. Instead of school, it might be showing up late to work or missed appointments, difficulty managing their schedule, or all of the household tasks. In a nutshell.
Yeah. To add on to what Lauren shared, I think emotional dysregulation plays a huge part in ADHD, both in adults and kiddos. And what I see is like the younger kiddos, you might see more of that externalizing behavior that Lauren was mentioning. They might be socially have some difficulties pushing other kids or not having awareness around their body, or really externalizing their emotional dysregulation, hitting, throwing things, and damaging property. With adults, you might see that a little bit more around irritability, having social difficulties at work, really having trouble managing the tasks and the organization and the executive functioning. And really what you might be seeing is the emotional dysregulation portion of things, and maybe not so much about them forgetting things, or maybe like some of the more objective things we see in kids, because kids usually go to school and they have a lot of structure already in their life. So oftentimes it's a little bit easier to pinpoint, what kind of vulnerabilities or deficits they might be dealing with. I also find that with children, because we treat children as young as 5 years old all the way into their teens and young adults. And so for me, I notice a huge difference in kids that are in elementary school, middle school, versus if they're in high school or even in college. And I liked, Lauren, what you brought up, like the procrastination part tends to be more visible for like the young adults and high school kids that I see with ADHD. It's manifesting more as that like internal restlessness, having difficulty starting a task, or really, getting themselves to start whatever task they know they have to complete, as opposed to the younger kiddos where it's staying focused. And you might see a little bit more of that impulsivity or distractibility with the younger kiddos.
Sure. I mean, I can jump in as well. So I mostly work with adolescents and adults. So one thing I notice in adults is that there's a tendency to be impulsive. So let's say acting without thinking of consequences. Sometimes it even borders on like risky behaviors. And then sometimes the parents are unsure, unaware of why that's happening. So sometimes you can kind of trace it back to some of those challenges as well. And later, what I've noticed, let's say later 20s, early 30s, sometimes not even feeling motivated as a result of some of the consequences they've struggled with up until that point is also a common thing that comes up. And that sometimes is hard to tease apart because not being motivated could be as a result of so many different things. But if you do your due diligence in terms of assessment, you'll begin to kind of look back and see some of those patterns that we're discussing today, all the way from childhood up until that moment. So that's one thing I kind of wanted to throw in there as well.
Yeah. I also think a lot about kind of the developmental trajectory of a child with ADHD. And so one difference that I often see is that, I mean, at least early on, it can often just be just pure ADHD where there's not all the other things that kind of come with it. But then pretty quickly, it's kind of like a snowball rolling down a hill. It kind of just picks up more and more, you get anxiety, behavioral issues, these things. And then I think by the time you're an adult, if it's been untreated, you may have collected a lot of stuff through all those years. And it kind of gets baked into your personality at a certain point, which I think can contribute to the lack of motivation Dr. Lukin's talking about, which I think is one of the things that's so important about the early intervention, because ADHD eventually kind of becomes comorbid with so many other things.
Okay, wonderful. Thank you guys so much for talking about the distinction there. And then we have another question, a follow-up from one of our patients. What role do sleep challenges and executive functioning difficulties play in ADHD? And how might these show up in day-to-day life? For example, a college student who struggles with routines and organization.
It's a loaded question.
I was going to have Dr. Patel answer that first.
To clarify, so the question is sleep difficulties and organizational difficulties, like what was the question?
Yeah, for example, a college student who struggles with routine and organization, how do these show up in day-to-day life?
Okay. So college students, a lot of the college students I work with, we talk a lot about their schedules. They're not structured, right? Like they can have a couple of morning classes, they can have a couple of evening classes, and then like a space of time, let's say 6 hours in the middle where they don't have anything to do. And how usually what I see, or we're talking a lot about, is that space of time tends to just be not used in a way that maybe is efficient or productive for them. However, socially, emotionally, academically, and that they tend to sort of take a nap, relax, or just kind of lose track of that space of time. And then before you know it, it's time to go to your evening class. And a lot of the tasks or a lot of the things that they should be doing or want to be doing kind of take a back seat. So I think for college students, that's a really big struggle. And a lot of our conversations are around, obviously, the medication, using it in a way that can enable children and adolescents to do the things that they have to do on their schedule. So for college students, we're working a lot with shorter acting medications or timing of the medications in a way that they can enable themselves to do the tasks that they have lined up for them. And then I'm sure I'll let Lauren or Gabrielle or Dr. Lukin comment on like therapeutically. I'm sure there's a lot of work you can do to help people be a little bit more mindful and intentional around their spaces, their breaks during college, to make sure that they are filling up their cup or doing things that can actually help motivate and like help them stay on track throughout the day.
Yeah, Lauren, do you want to take that? I feel like that is right up your alley for all your college age clients you have.
Sure. Yeah, I think when it comes to the organization and executive function piece, and to be that self-starter when you have this chunk of time in the middle of the day, and it's maybe not what you're used to in also like say grade school, when everything is really laid out for you, piece by piece, you have to learn those skills like chunking your task into smaller bits or putting deadlines on it yourself. I love to ask, I call it the future self. Like, what do I need to do right now that my future self will thank me for? And that one tends to get clients going to think about, I have to choose my hard. Would I rather do it now when I don't feel like it, or I don't know where to start? Or is it hard when I get that backup effect, the compilation of all of my assignments and things, and I have to say no to that social event later because I didn't study or manage my time properly. So that time management, the organization, it could be as specific as looking at a system for getting used to the electronic learning systems, like your Canvas and Blackboard and things like that, getting really familiar in a routine to automate as much as possible. What are my incoming and outgoing assignments? What's my agenda look like? I like those written ones, but everything is digital these days. Accountability buddies. Do you have a study buddy, a study group? Are you using the academic resource center? Are you studying in the library where you're surrounded by others who are in a focused mode in a distraction reduced setting? Or are you trying to do it with TV on in the background? And everyone learns a little bit differently. So I think also just taking a look at what kind of learner you are. Many of those things could help kind of scaffold the mental labor and the emotional labor that goes into the executive functioning. And then furthermore, just to kind of comment about the sleep piece, then at the end of the day, when you're trying to settle and relax, if you still have that list of homework on your mind, it might be unsettling, let alone if hyperactivity and the restlessness is in the picture already. Hard to settle your body, to relax, or knowing that, oh, I procrastinated and tomorrow's going to be extra challenging, or how do I go about asking the professor for an extension or additional support? So yeah, being able to settle your body at night is and will be hard as well, whether apart from or in addition to the challenge of managing all of your daily tasks and using that time well, staying organized.
Or just to kind of add a little bit to that, my angle or the way I try to approach it with young adults or college kids is, it's obviously in addition to what was just described, but I always try to look for secondary gain. So for instance, when you're thinking about sleep patterns, right, it's often, oh, I didn't go to sleep because I don't know, I spend more time on my phone, or maybe I went to this party, and we try to identify what are some of the values underneath it. Let's say social connections. Let's say maybe that young adult didn't have as many social connections in college, in high school. And now that they're coming to college, now all of a sudden they have a very vibrant life, right? So we try to think about, okay, are you trying to compensate? Are you trying to use something else that's important to you in lieu of doing what you really want to do? Similarly, if they're not structuring their time, often what I try to do is tease apart really slowly, almost like a chain analysis, to see where that's being interrupted. So there's another priority or another value comes into play and really distracts the person from doing what they want. So a lot of people that are coming in, especially young adults, are not really aware of the whole dynamics of what drives their behavior. So sometimes being able to take your time and talk that through, identify the secondary reasons for why that might be doing it, not necessarily changes it immediately, but then we can open up a conversation about, okay, how do we take what you want, like sleeping consistently, doing some of the work, while at the same time fitting into some of the other values that you might have. So often I notice that goes a long way.
I really love that approach, especially around sleep, just because I think we all know sleep is so complicated. It's complex. There's a lot of different factors that affect people's sleep, from, obviously metabolic, social, emotional, academic, all of the stressors that we have. And so that's pretty similar to my conversations I have with parents with young kids, but then also young adults around sleep, is really figuring out what the barriers are, what kind of contributing factors exist in their life that might be making sleep more difficult, and kind of looking at it more of a long-term approach, that there isn't any short-term fix usually to improve sleep that's going to be maybe as significant as you want, but long-term, if you're able to think about these things and your values and some of these barriers with your therapist and your doctor, then you have more long-term success around healthy habits and just structuring your life in a way that feels really restful for you. So I really appreciated that you said that.
I just want to piggyback off of that too, Divya, because I feel like what happens is we'll get a call in that a mom or someone who's 18 is ready to go to school and is like, hey, I'm about to go to school and now my whole world is kind of upside down and I don't know what to do with this. So the sooner you do it, the better. And so, that summer, you're not really sleeping, you might be going out, you might be doing other things. So it's better to kind of call in and build your team to help you set up that healthy lifestyle before you go to school so that when those challenges do come up, you're already prepared and ready. So.
Exactly.
I'll point out, by the way, that we're not even talking about medication right now, right? All these things, I think a lot of times people think of ADHD as stimulants, like the medication, which I'm sure we'll talk about at some point today, but there's so much more that goes into it than just medication, which I think is important.
Yeah, agreed.
Speaking of medication, I think we have a question that came in from one of the attendees. If a 12-year-old is continuously forgetting to take her ADHD and anxiety medication, would you recommend the parents step in and make sure the medication is being taken, or look to support the independence of the 12-year-old child? What do you think, Jason?
That is a great question. So it's a tough balance because you're trying, between the age of, let's say, 12 or maybe 11 and 12 until maybe your 20s, I think one of the biggest developmental milestones is the balance between independence and autonomy versus dependence on your parents. So this is like the crucial developmental stage that a 12-year-old girl is kind of beginning to get into. And so the reason why a 12-year-old doesn't live on their own is because they don't really have the full adult judgment yet to make these decisions on their own, right? But if you come in as a parent and you crush them and you crush their independence and their spirit, you might be able to get some compliance, but the cost to that relationship, I think, could be really high. So the way I look at it is that they don't have to take a medication necessarily, they have to be responsible, right? And so it depends on the situation, like if someone has, let's say, to take an extreme example, someone has cancer, let's say a child has cancer and they say they don't want to take the medication, most parents probably wouldn't say oh, I don't want to stop your independence, you know what I mean? But if it's ADHD and it's not, quote unquote, as big of a deal, maybe you give them a little bit more freedom. I think having a dialogue with a child and saying, look, this is the situation, these are the options, right? So if you don't want to take a medication, what are you going to do, right? We just talked before about all the other options. So are you going to go to more therapy? You're going to do executive functioning coaching. And as long as they're taking, responsibility, maybe in a couple of years, then they start taking the medication again. But I think opening up a dialogue is the best thing and trying to be respectful. But also I think not being scared to really step in and say, I really think you should be taking this medication. Your doctor says you should take it, So it's kind of walking that balance.
Yeah, I agree. And I think it helps when, you get to know the child and the family a little bit better to really understand, I have a lot of children that are resistant to medication because, they feel that this isn't, no one else their age is doing this, or this is something that, is something bad, right? Like why do they have to do this if their sibling doesn't, or if their friends don't have to? So in those situations, I do think, again, having a conversation around what are the reasons we're taking this medication, maybe focusing if the medication has positive impact in their life in any way, that I find that really helpful for parents to help, and for the doctor and the therapist to also just sort of work together and having the same messaging around, these are the things that maybe it's helping you with. What do you think? Do you think that it's helping you with these things? And oftentimes if it's coming from the child themselves, then that might help them feel like they have some control or decision-making power with what medications they're taking. But it is a long journey, especially if it's coming from the core issue of feeling less than, or feeling like there's something wrong with them, that they have to take this medicine. And so I think it really depends on the dynamic between the child and the parent, and how you can approach it in a way that feels enabling, supportive, and understanding, right? Empathetic to that is something that a lot of people would struggle with, or that is something that a lot of, people would think about. Let's try to think about it in a way that's the most helpful for you right now. And I think the decision depends, right? Does it make sense to take a break and help them, give them time to work with their therapist on some of these things? Or are the symptoms of ADHD so, detrimental to their life right now that maybe it has to be a continuous conversation, but maybe we don't pause the medication? So I think it's a more complex issue sometimes, and it really depends on, the relationship you have with your child, of how much you can openly talk about these things.
The only thing I could jump in is that it sounds like that question has two parts, or at least that's the way I'm hearing it. One is whether medication is needed at this point in time, and that sounds more of a conversation of symptoms, potentially partnering up with you, Dr. Patel and Dr. Dean, to figure out if that's the case. I also heard a little bit about if that's already decided that that might be beneficial, how do we come up with a plan to get the child to actually do it themselves and create a sense of accountability around it. So to me, those are kind of two different things. So the first part, I think it's more of a conversation with you to kind of figure that out. In terms of accountability, to me, that's more of a behavioral strategy. It doesn't matter to me, it doesn't matter if it's medicine, if it's we're trying to think about some exposure and response for OCD, or we're trying to encourage positive coping strategies. It's about how do you build it in? How do you develop behavioral strategies and patterns to make sure that the behavior that you'd like to see, in this case, a 12-year-old taking the medication independently, is really achieved. So I think if the parent can see it in those two different ways, I think the way they would want to go about it might be a little bit slightly different. That's the only thing I kind of want to throw in there.
May I, Dr. Lukin, perfect segue. With my solution-focused hat on, if you're looking for a strategy, one of my favorites, and particularly the word forgetful was used in the question. So if it's a matter of trying to remember and develop that routine to better integrate it, it's called habit stacking. Habit stacking. So like you were to stack, blocks, we're going to pair an already established part of the routine with this, new habit of taking the medication. So if my favorite one to habit stack medication with is brushing your teeth. So if you're brushing your teeth every morning or every night, and if it's a morning med or an evening med, you can pair that. So place that medication next to your toothbrush. So toothbrush, done, put the toothbrush down, move your hand over right there. It's accessible. It's a visual reminder. It's right there, easy access. Boom, take your medication, sinks right there. Little cup of water if you need that to swallow, or right. And it's all right there for you. So we want to take an existing kind of given for sure part of the routine and pair it with a new habit we're trying to insert into your series of morning routine or evening routine events. So you can talk about that together, collaborate to see what would be the best slot for this new habit in your already existing routine.
I love that. And just to jump in, even like setting like a timer or something, or like maybe the same time at, 1 p.m. every day it goes off, or if it is right before school, like that 8:30, like, okay, it's time to take it, so that it becomes a habit. We all know that habits take time to be instilled, right? It can take months. So having that, like Lauren said, that during your toothbrush or like having that timer go off is helpful because it does take some time for habits to build it. So
yeah. I like that. And I guess one thing I also sometimes suggest to parents is with that, you can see, if you can divide the medication in 5-day slots or something like that, where it's easy for the child to visualize, which day, like how much medicine they have to take. And then with that, you can pair some sort of positive reinforcement. So, if you remember to take your ADHD medication 5 days in a row, this is something you earn on like the 5th or the 6th day or whatever it is. So slowly, I would say you start with the one step like Lauren had recommended, and then if they are getting the hang of it, or if the kiddo is really committed to working on that with you, then maybe you can add in some fun things that could motivate them or help them feel good about taking the medication, and in turn build their self-esteem and independence around that.
I'm actually curious if I could ask you guys, because, we're prescribing the medicine, but you guys are often like on the front lines talking to people about the medication. Does that come up in therapy sessions? People say they're not taking the medicine, and how do you approach that?
Yeah, right. It's a little bit of a deviation sort of from ADHD med specifically, at least for me, but it does come up a lot with people make these, I don't want to say assumptions, but determinations about they've heard what the psychiatrist had to say, then they filter it through their own thinking, through their own ChatGPT and Google, conversations with their significant others, family, friends, therapist, and then they come up with their own schema of how they would like to see the medication. And that sometimes impacts things to a degree where it's either they're not adherent to the treatment plan you guys prescribe, they're not taking it consistently, they begin to lower the dose, sometimes without notifying you, or coming off, although knowing that some of the medications, they're urged to be able to make sure that they decrease over time. They take the initiative, what I've noticed sometimes, to do it themselves. So those are some of the barriers that I see. Granted, I see mostly young adults and adults, but those are the things that usually come up.
Granted, I see mostly children and really young children. So some just really aren't medicated, to be honest. But those that do or are on that on the cusp of considering when, symptoms, they tried the therapy for a while and, symptoms are just really impacting daily functioning, and we're about to have that conversation and I'm about to send them over to you guys. One way that I explain to kids the differences, with put really simply, right, with psychotropic medication and stimulants that, and I know we're talking about ADHD here, but for a mood enhancing medication, I'm trying to explain that some are as needed, but for the most part, this is going to be something that you incorporate in your routine. And it's not like, ooh, I have a headache, I need a Tylenol, I need an Advil for this moment, but helping them understand that it's something that we're going to have to do regularly and consistently. And then furthermore, this kind of maybe buzz term that's come up with more of the stimulants is the medication vacation. So, maybe in the summertime, parents will collaborate with their prescriber and ask, well, we don't have these high demands for focus right now. And, actually there's an impact a little, on appetite or sleep. Do you think we can take a break? And it's not within my scope to say yes or no. I, redirect them to you guys. But that's a common thing too. So with the stimulants, maybe not having to be so much of an all or nothing, but certainly not in my limited perspective, oh, I have a big test, I got to push through, let me take it today. We still want to use it as prescribed and more consistently than that, if that is how it's prescribed.
Yeah, I think I appreciate you saying that as well around it just highlights the team-based approach, I think, for all of these things, but especially with ADHD, a lot of it, what we're talking about is all of these approaches works together, and we want the person to also be able to speak freely with their doctor, their therapist, and for the therapist to be speaking with their doctors. I think it just speaks to the benefit of having a team that collaborates heavily and is able to more efficiently get to the root cause of certain issues, why they might not want to take their medication, or get that information around medication breaks efficiently, right? And being able to reach out to your doctor, your therapist, and for them to speak with each other in 2 days as opposed to 2 months makes a huge deal, I think, for the quickness with which people are able to respond to medications and therapy, and then also how supported the family or the child can feel as they navigate some of these struggles. We know that it can be a lengthy process to find the correct medication, to find the correct therapy and the therapist. And so I think that overall, if you're able to work with a team that's collaborating really heavily, and you feel like you can ask your doctors these questions, then you're in the right place, because you'll be able to feel good about your treatment and feel good that you're doing all the things that you need to do for that long-term success. So we're really always just thinking about that long-term success and figuring out, especially with ADHD, how to plant those habits and those, foundational thinking around what's good for you, what's going to benefit your future self, all of the things that you mentioned, Lauren. I think that is really important to talk about early on with a lot of kids, especially, so that they can carry that with them through college, through their careers.
And one thing just came up for me, why to me it's so important to get the right therapy and the right medication earlier, because to Dr. Dean's point earlier, what you said, right, it snowballs, right? And then there's a sense of personality and a personality identity around some of the strength and challenges that they have. So the people that I'm thinking that I work with, they've built into their sense of self some of those, I wouldn't even want to call it struggle, but some ways that they have maybe a limited attention span or some of their impulsivity, they use it as to define themselves. So when they think of, oh, maybe I should get on meds, one of the tension points would be like, oh, then I'd be a different person. Even if it would be for their benefit, even if it would help them focus more and stay completed tests and to get the behavior initiation, sometimes there's that conversation where like, ugh, but this is me. And then that sometimes presents in therapy, and we try to talk about, wait a second, what parts are you? Let's figure out some of the symptoms. Let's figure out how we can tease apart what could be most effective for you as a person. But I do notice I have several people that I'm thinking of that's a big challenge in itself.
Yeah, I think that's a very common challenge. And even on the side of parents, where oftentimes parents may feel guilty or, question of whether or not they're, let's say, considering medication for their child where it's going to change them or they want to change their kiddo in any way. And we work a lot, I think, around that as well, like understanding what the medicine can be a useful tool for and how to not let it change anyone's personality or anyone's core sort of behaviors or values. And I think that is really another important point in like understanding yourself better and understanding what kind of habits, medications, therapies will be helpful for you and what maybe is not so helpful for you.
Wonderful. That was some really great insight there. And I think you answered a lot of parent questions with that entire overview. So I did have a specific question that did come in about a child or a teen that's feeling conflicted about needing the medication. So they recognize that there is a benefit to it, but they wish they didn't have to take it. How would you, I guess, approach that with communication or the emotional support and identity around medication?
That's a good question. These are all good questions. So I usually use an analogy, like a sports analogy, especially because kids are usually into sports, not always, but like if you injure your knee, let's say, and you're told that you really shouldn't be going out and playing that sport, and you don't listen because you don't want to accept the fact that you're hurt, you go out, you just like totally destroy your knee, and so what I say is, not to call it like a problem or an issue, but if you have an issue, if you have a challenge or a struggle, you have it whether or not you acknowledge it. The only difference is if you acknowledge it, you can actually do something to make it better. Often if you take a medication, it can help you tremendously. And then you can kind of move forward. And, with the sports analogy too, like that same person with the knee injury, if they go to a physical therapist, right, they might need to take a medicine to control the pain so they can do the physical therapy. But it's really the physical therapy that's fixing the knee. It's not the painkillers, And so similarly, like with our partnership where we give the medication, and then they're in therapy, it's really the therapy and really life. Like I often say, the best medicine is a successful childhood, but if the symptoms are getting in the way of a successful childhood, therapy, parenting, all these things working, sometimes you just need that pill. But then you kind of jump into this like kind of, upward trajectory with all this stuff. In a year, let's say, or 2 years, our goal is always to get people off medication. So I think almost everybody that I meet with, I'm sure Dr. Patel, I'm sure is similar. Almost everybody, they don't want to take medication, but I think if you kind of just help them, it's like accept their reality, not to dismiss it, but that it's very human to feel that way. But I try to frame it in that positive way.
I love that. And just also to jump in. So when we do get maybe a call about a parent or about like my teenagers on medication, not sure if they wanted to take it or however the conversation is going, we say the same thing also with therapy in a way with medication, like they work together to build up like who you are and to make you feel better and be in a better place, but not to be on both of them forever, right? And so I think that brings a lot of comfort to all ages and all the parents who are like, I think my child needs this, I'm not too sure. So when you hear like, hey, this isn't forever, they kind of like let go of that, like that push and pull, because we say, hey, it's okay. Like we're going to help build your team, make it good. We're going to be there for you. And then, we'll also send you off on your way. And they're great. Feels a little bit better.
The only thing I would jump in is to say that there's a whole almost like a psychotherapeutic treatment model called motivational interviewing that really gets people going and really creating a space of willingness. And that's either be it for adults or teenagers or preteens. So that's a really great therapeutic way to kind of get people to move into that space of doing something that may have some resistance about. So that's definitely a thing. But in those moments, it is shifting into that space of willingness. And how do we get people to do it? Be it through conversation with your person who's prescribed medication, therapist, it could be a parent. But there are specific ways how to get a person knowing something is good for them. And then there's a good amount of resistance against it, how to bridge that gap. And that's true for these types of medications. It's definitely a powerful tool for substance abuse concern. So there's a good amount of overlap when we're thinking about motivational interviewing.
The last thing I'll add on to all of these really good points is that my first approach around that question is usually just really normalizing, that those concerns are valid, and then also kind of giving real life examples, because I think it comes from a stem of just feeling fearful of what is the future going to look like? Am I going to be successful? Am I going to be able to go to college or have a good job and all of these things, especially if teenagers or like young adults are bringing it up. And so sometimes I just kind of give them real life examples of like, you might know these people, or, you might have a doctor or a lawyer or any of these people in your life that have ADHD. And depending on how they structure their lives, they're able to figure out whether or not medication is needed, right? And then I'll give them an example, like an emergency medicine doctor versus an anesthesiologist, right? They have very different work settings. And one setting obviously is very chaotic and difficult to focus in just at baseline, and another setting is very controlled and very quiet and very sterile, and maybe provides like an opportunity for you to use some of these skills that you're learning. And so I kind of just encourage and enable people to really understand their personalities, and also through therapy kind of figure out what is going to suit their strengths and what kind of career, what kind of things that they want to accomplish that might be well suited to their strengths, and maybe not kind of highlight the vulnerabilities they might have right now around executive functioning or inattention. So I like to just kind of throw in some of those kind of examples to just bring down some of that stress of the future, and what all of these things right now are going to mean for them. I think it helps to just think about the long term, kind of understand yourself better. You'll figure it out. You'll be able to figure out things that you think you can be successful in.
You bring up the fear element. If the hesitation to taking the medication is around fear, and there's well, what if, and these side effects, and I don't know how it's going to affect me or make me feel, will I be fundamentally different, with that fear, that anxiety, it's often that what if, like, what if this or what if that? And while many of the what ifs default in the negative, what if in the positive and say, well, what if it actually helps me better utilize the tools that I'm learning in therapy? What if it allows me to focus better, receive the information that I'm getting in class, create these systems that work for me. So I think there are, when you're weighing what's the side effect of taking the medication, and then what's the side effect of not taking the medication. And we don't know if we don't try, and that's the big unknown question mark that often raises anxiety. So dare to step in and try and see, knowing that, nothing's permanent. You could always wean properly, or try a different kind of medication if one doesn't feel right for you, right? That's where I pass it back to you guys, and you can work with them to find a fit that feels good for them. And this all pivots on what are the barriers, and knowing what the resistance is, leaning into that resistance, and then getting more information so you're empowered and informed and normalized, and step into the process more motivated, more willing to see, well, what if it helps?
One other thing I always try to do is that, because it's interesting how when people come in, they think about symptoms and areas of growth on one hand, and they use the word, I don't know about the side effects of the medication on the other. So what I try to do is try to make sure that we're using the same language. So I try to say, yeah, no, I totally hear you about the side effects of taking medication. Let's think about the side effects of not taking medication. Right. And it's that simple, from going from symptoms or areas of growth or challenges into using the same language. It helps people to like, oh, right, I never thought of it this way, because they think like symptom, that's sort of like me, then I take medication, oh my God, all these possible side effects. But if you kind of try to help people see that it's like, if you're not taking medication, here's all the side effects. And that sometimes helps to reframe how they begin to think about medication.
Right. I would also highlight that it's a whole conversation, you know what I mean? And that's a really big part of why we take the approach that we do, of really trying to meet with people more frequently and talk to them extensively about these things, because I know that some psychiatrists will just do an evaluation, then just prescribe a medicine, and there's not much of a conversation. I often say that, like, this might sound weird, but the easy part is coming up with a diagnosis and the medication plan. You know, the hard part is actually helping somebody understand why they should take it, you know, or should they take it, or just kind of giving them how to think through, you know, how much you're recommending it. And so I think that's really important. Like when someone comes in, one of the first things I'm doing is trying to just connect with them as a person, you know. And that's why this came up recently. Someone was asking, you know, if we actually meet with the child, or we just mostly meet with the parents, you know. And I was saying we have to meet with the children, because that you have to build that relationship, you know, so that then when you actually recommend something, like all these things that are coming up, you know, if you don't have a relationship with the patient and then these questions come up, you're not going to really be able to influence much.
And I think, Jason, the relationship also helps us sort of support people through this fear, the what ifs that, you know, we were talking about, that you're not going to just start a medication and kind of be on your own for a whole nother month without any sort of support. Or if some side effect comes up, or if some question comes up, you have your therapist, you have myself, you have your psychiatrist to really, you know, reach out to us, ask those questions, get some reassurance, or, you know, support around what to do next, right? So I think it helps people also feel more grounded in their decisions, that they're not navigating a lot of these things by themselves, because it can be stressful and it is sometimes not straightforward. And so I think that also helps people, again, more efficiently respond better to medications, to therapy, all of these things, when we're really there every step of the way to address their concerns.
Fully agree. Yeah.
Great. And I just wanted to touch up on the last topic here, because we're going to be running short of time, but school is a place where many of these challenges become visible. And we had a question come in. What are some of the best 504 accommodations or school supports for a child who struggles with focus, impulsivity, or talking constantly in class?
Lauren, you want to take this one first?
Sure. I think this is where we need to expand the team and pull the child study into the picture. So that's or maybe synonymous, the academic resource room. What your school has available, particularly public schools tend to have, you know, resources of this nature. So I want to know a little bit about the role of a case manager, the role of a behavioral specialist. Is there a paraprofessional? What does that look like? And what are the resources available at that school? Some of the most, I guess, classic accommodations that I hear in IEPs and 504s could be, you know, taking breaks, visits to the school counselor or guidance counselor. It could be having a fidget at the desk, or a bouncy band at the bottom of their chair by their feet for, you know, hyperactivity or grounding. And I think when coming up with these accommodations, the question to ask is not only what is the function of the behavior, but what can I do? What can I do with an urge? It's don't talk to your neighbor, don't interrupt, don't call out, but what can we do? So, you know, is there a system where, you know, if raising your hand isn't working, is there like a red light, yellow light, green light, you know, system to signal to the teacher? Some of the kids like to have like a secret code, a gesture of sorts to their teacher to say, like, I'm losing focus, I'm tapping out, or I'm really lost here, and maybe don't want to speak up and say that in front of the class. Is there a way to build in some extra time at the end of the class to check in on Blackboard, on Canvas, to see what your assignments are looking like, or to ask those questions that are coming up during the class? So what can I do with this energy? What can I do with a big feeling, an urge, not just what you shouldn't do, redirecting to a more appropriate time or outlet for that thing? Is there a sensory room? Can I ask for some fresh air? What is feasible for me, and how can I ask for, how do I know that I need that thing, and how can I ask for that thing?
Dr. Tapel?
Yeah, I agree with everything that Lauren said. I think that it's important to really understand. I usually just speak with the teachers and the if they have a child study team or a psychologist on board, depending on the school, to understand what kind of behaviors and struggles kiddo might be having. And then I'll speak with the child also to understand their perspective on like what's really difficult, and then help bridge some of that gap of what can be done, right? Like I'll ask those questions sometimes of like, is this possible? To really understand limitations around the classroom setting too, right? Is this going to be possible for the child to be able to have access to fidgets or to have access to breaks and all of those things? But I would agree the fundamentals are likely having access to breaks, having access to be able to redirect themselves. So can they play with the fidget and then redirect? Can they take a break and then redirect? Can they, be able to, I have some kids that just want to draw while they're listening. And so oftentimes it's just communicating to the teacher that they're not being disrespectful. This is something that they need to do to be able to register the information that you're seeing and come up with systems of a way the teacher can still check in and make sure that they're not completely off track. They are still tuned into whatever the lesson is. So I would say we do a lot of that work also to just kind of help bridge some of those gaps and like behaviorally understand what the child might need and then what can the school provide. But yeah, I think the first step is likely just having a joint conversation as a team and figuring out what the solutions would be.
The only thing I would add is that we actually have a person here who all she does is kind of navigate these challenging conversations and empowers the family to understand how the whole system works. Because, I don't know, you probably see the same thing, but a lot of parents come in, they're not sure what their rights are. They're not sure what could be asked for. They're not even sure the definition, legal or ethical or otherwise definition of some of those terms. So one thing that just comes to mind is that we have a person who's been in that system for over 35 years. So sometimes just having somebody point you in the right direction and understand the whole system, that would really empower a family to make the most effective decisions for the kids. So that's just one thing that came to mind.
I think the one thing I will just like jump in to say that as like a parent, it's so important to kind of just be aware and definitely ask the questions to the school. Like, don't think you have to wait. Like, if your child is doing XYZ or seeing things, like speak up as soon as you can, and you will be backed up. Like, I cannot stress enough the importance of like building your team and, advocating as much as you can so that your child can succeed no matter their age.
Well, thank you guys for your thoughtful discussion here. I feel like I've learned a lot in this session as well. So thank you, Dr. Dean, Dr. Lukin, Dr. Patel, and Lauren. We hope that today was shed a light on ADHD and letting you know what your treatment options are and how therapy and psychiatry can work together. I just wanted to remind you guys that you'll have access to this webinar recording within the next 48 to 72 hours with the next newsletter that comes out from us. If you guys have any additional questions or you want to learn more about either of our services, you can visit our websites. It's developmentalpsychiatry.com or lukincenter.com. So I wanted to thank you guys again for spending your afternoon with us. And, if we have any future events in the upcoming time, then we'd love to see you there. So Thank you so much, everyone. Have a wonderful day.
Thank you so much.
Thank
Bye.
you.
Bye.
Bye.